Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I am doing a special series on how health tech companies are handling COVID-19. So who better to ask than the president of Livongo, Dr. Jenny Schneider. So Jenny, it's a pleasure to have you with me today.
Thank you, Jess. Great to see you again.
Great to see you too. I mean, I know we are both sheltered in place in California, so it's a pleasure to talk to you. I'm dying over here myself, actually.
I know, for extroverts like you, it must be hard. And I need you. I miss you with the, my hair is missing you. Usually you comb me down before we do these.
Yeah, right. Thanks. So I want to jump right in, Jenny, and just talk to you, I guess, about what's going on at Livongo. So, I mean, it's been really interesting tracking all of the news about, COVID-19 and about how, there's a lot of concern about the overburdened health system. Increased traffic, patients waiting in waiting rooms, people not getting care. And this is something in health tech we've been worried about for a long time and trying to solve for. But, I'm curious as far as Livongo is concerned, the type of care solution that you guys have built, how do you see your role in all of this in terms of helping offload the burden of the traditional healthcare system, especially as those hospitals start to, reach and exceed capacity with people who are sick?
Yeah, it's a great question. So as you know, our mission at Livongo is really about empowering people with chronic conditions to live better and healthier lives. And the approach we've always taken is to meet our members where they are in their own life. So we've built an ecosystem of solutions where we can collect their data very passively and give recommendations right back to them without having them swerve out, without having them go to the doctor's office, but meeting them in their home, in their car, in the sports field, wherever they are. And so in this ecosystem, one of the things that we continue to do is be incredibly focused on our members and delivering care. Our very unique ability to understand in people with chronic conditions, diabetes, hypertension, we can actually understand and see their data to give recommendations. We've been able to do that all along. It's incredibly important for those vulnerable populations in this time that we keep them outside of exposure areas and be able to deliver care. And if you look at sort of what's happening in COVID, it's those of us living with these chronic conditions are at highest risk, not to contract the disease, but highest risk for outcomes. We're all equally likely to be infected, but those of us with vulnerable populations of chronic conditions are more impacted in terms of the outcomes. So our unique ability to be able to see what's happening in that population and deliver that care remotely is incredibly valuable, always, but particularly in this strain time.
All right, I want to go back on two things. So the first thing I want to go back on here is the data. So I know you guys have your AI engine, and you're collecting all of this different biometric data from your members, and you're feeding it back to them in real time. So I guess, are you able now, like during this time, are you guys watching the data of your members to see if there are any unusual blips or things that might indicate illness? Like how are you guys handling that now? I'm curious.
Yeah, it's a really great question. So one of the things that we can do is we can track trends and patterns in people. So if we start to see someone who's been very well controlled with their diabetes in an endemic area or a high concentration area, and we start to see AB normal or abnormal blood glucose readings, it's an indicator that there may be signs of infection. So we know that in people with diabetes, when they have infections, virus and otherwise, blood glucose levels tend to rise. We also know that the support in the setting of COVID-19 or in any other virus or illness for people with diabetes and for hypertension is supportive measurement. So this is, again, looking at medications, looking at foods, giving recommendations for fluid intakes, exercise, rest. And that's something that we've been able to do and been set up to do both through our digital components as well as our certified diabetes educators and other coaches who can also provide that coaching real time to our members in the setting of the data. I think, again, this underlying component of the setting of the data is really important to be able to provide specific recommendations.
Okay, onto that data. So in all of this, we had those HHS interoperability rules get, passed and whatever, but we are so far from having that implemented. So a Livongo member that has all of this rich data that you guys have been collecting, can you take that as a member and bring that into a different healthcare setting? Like, so say, heaven forbid somebody does get sick, what are they able to actually take with them from the data that they've got managing their chronic conditions with Livongo, what are they able to take into the hospital setting or to their doctor's office with them?
Yeah, it's a great question. So I think one of the most valuable assets of our solution is, again, all of our data, whether that's blood pressure, weight, or blood glucose for the different solutions, is all captured through a cellular enablement. So you don't have to pair Bluetooth. You never have to write anything down. And we give that data in a summary report directly back to the member. We can do that in a variety of different mechanisms. We've also integrated those data reports into electronic health records, a number of electronic health records, so that the providers can see that. But we've made it incredibly seamless for any individual member to share that data with whomever's on their care team. It may be their parent, it may be a nutritionist, it may be their doctor. But we have that studied in the data sharing. We put the member at the center to give that to other people. And so it's been very seamless and a great tracking mechanism. We often hear stories of members who have something new come up and the doctor will ask, well, have you been recording? And they say, actually, here's all the data, and it's just seamlessly there in a report.
That's perfect. And on the virtual care side of this, I mean, lots of excitement in our industry about how quickly some of the regulations have eased up to allow different practitioners to practice across state lines now. I saw Blue Cross Blue Shield of North Carolina issue this press release saying they're going to start reimbursing telehealth services and virtual care services at parity with in-office visits. So as far as all of that goes, I mean, you guys have a virtual care telehealth component to Livongo, kind of in two different ways, as I understand it, right? So there's the coach that can kind of come in and talk you through things that's provided virtually, and then you guys can refer out. Is that right? So tell me, I guess.
Yes, both are.
Yeah, so tell me a little bit, I guess, how you guys are positioned here, because you're in a unique spot, right? Like, you're not like a traditional virtual care, like a telehealth provider, like a Teladoc or an MD Live or something like that. But you're kind of in the middle section, and you're focusing on such a niche population in terms of helping them manage their chronic disease every day. So tell me, I guess, how do you see this all, fitting in, and what you see your role being as things start to get a little bit more serious here in terms of the number of people who are presenting with COVID-19?
It's a great question. So I'm going to start with saying, I think that the world has been shifting toward more and more virtual care over time. I think the tipping point of COVID-19 has made that very apparent to people that the time is now, and the benefits of remote monitoring and telehealth services are very, very high. We are positioned to care for people with chronic conditions. Remember, there's 140 million of us living in the United States with a chronic condition. Our value proposition is to collect that data seamlessly so we can deeply understand where anybody is and where they're tracking, give them some nudges digitally, and then pair that with a coach, a live person when they need it. We've also partnered with MD Live and Doctor on Demand to escalate when they need a provider. Now, the difference is telehealth doesn't have access to all of those underlying data, and so it's harder to make a recommendation. So the partnerships that we've formed are really a win-win across the ecosystem and predominantly for the members, where we've remained hyper-focused. Again, this is the setting of COVID-19, I think, has accelerated the attention in this area. And I believe that we're at a tipping point that the value proposition above and beyond COVID-19 is now being more fully understood, and that the ecosystem, healthcare, education, otherwise, will start to shift. Zoom interviews, maybe we'll do more of these and less in person, which will be a little sad for me, right? But I think that there's some realization more broadly around the technologies and the ability to reach people and fit things in that are here to stay, and that's a very positive thing for us.
All right, let's have some good news here and take that a little bit further for me, Jenny, because I'm curious. This is a tipping point, you say, and I think a lot of people are looking at that. I mean, if you go on Twitter and just have a look at any of our health tech friends, I mean, it's just like, as far as virtual care is concerned, people are like, the genie is out of the bottle. This is it. So, I mean, paint a picture for me. I think, long term, best case scenario, we all get past this. what does this do for companies like Livongo, companies that are digital health companies or health technology companies, as far as the way that we interact with the traditional healthcare system? Do you think like this was our moment to prove ourselves? We're going to step up and we're going to nail it, and so we're all going to be in a different place down the road? I mean, I know I'm asking you to kind of look into your crystal ball, but I mean, you know, from your perspective, as you're kind of looking ahead to, you know, we're going to get through this just fine, you know, what does the other side of this look like?
Yeah, I think of the broad picture of what value are we offering to our members, all of us in the healthcare ecosystem. So if we can create an ecosystem whereby we can keep specialists performing knee surgeries and back surgeries and making sure that the flow through is matched with the demand, and we're not overwhelming that, and we allow people to practice where they're best, we're going to deliver the best healthcare system. In that ecosystem, you know, our ability to continue to deliver messaging and behavioral change and deliver outcomes for people with chronic conditions who don't live in the hospital walls, don't live in the provider offices, is really high value. I think connecting, as we're doing, back into the ecosystem when they need to go to the hospital and when they need to see the provider is going to have incredible amounts of value. So I do think it's not a hospital versus digital. It is, how does the whole ecosystem work together? And I think one of the things we're all acutely experiencing now is that the hospital brick and mortar in surge times cannot handle the capacity, right? So it's, again, making sure that in surge times, but also in regular times, is the capacity right? Are we managing people where they are and meeting them where their healthcare needs are? And I do feel very proud of the ecosystem, the digital ecosystem, around the efforts that we've all been driving toward and making to make that better reality and make that happen for people. So again, I think the ecosystem will come out stronger because in this setting of inpatient and digital, we'll have a better optimal experience for members. It's not either or, it's a combination, and getting that balance right for the combination.
I have to say too, I'm really impressed with how agile the incumbents have been in a lot of this. Like, I really think that they've kind of stepped up. Yeah. Like, okay, let's do this. Let's look at the way they're reimbursing. Let's make this fair. Let's try what we can. On to that point, you know, as far as folks who have maybe not integrated Livongo into their healthcare plan or are providing Livongo to their employees, is it too late to talk to you guys at this point? Or like, I mean, like, let's say somebody's watching this and they're like, oh my gosh, you know, really this would be great for our population to have, you know, our folks with who are managing chronic conditions kind of have this other little niche to go into to have their data collected, you know, just in case, you know, if somebody wanted to deploy Livongo at this point, like, are you guys able to take on like a bunch of new customers? And can you guys turn this on remotely? Like, how does it, can you act quickly in a disaster situation here?
Yeah, yes and yes. You know, we are set up to be able to do this remotely. That's not an issue or a problem. We have maintained incredible focus for our own employees, ensuring that our employees are healthy, happy, and productive. And so we're ready. And so we understand that the value add that we have in this ecosystem, particularly in this time, is an opportunity and an obligation that we have to ensure that people in the United States are receiving the proper care that they can. So the answer is yes, we're ready. Yes, our employees are continuing to work. We've not slowed down. In some fact, we're actually in an acceleration period because we have both an opportunity and an obligation to make that happen.
Awesome. Well, Jenny, I mean, it's crazy times, and there's a lot to be concerned about, but I mean, there's a lot to be excited about in terms, and proud of, really, I think, with how the industry has been responding to this so far. So thank you so much for stopping by. Hey, last thing for you, do you have any shelter-in-place tips you want to share with anybody? How are you getting through this? I understand you're homeschooling children, like, oh my gosh, Jenny.
Yes, what I would say is I have a 7-year-old, a 9-year-old, and an 11-year-old, all of whom are at school, 1st, 3rd, and 5th grade. I'm learning lots of United States geography that I've forgotten over the years, as well as how to divide fractions. I hadn't done that in a while. But my tips are actually that human nature is human nature. So bribery works very, very well for young children. It's actually why it's quiet right now. So thanks for this opportunity to have some quiet in my own house. Thanks, Jessica.
I love it. No problem. Jenny, thank you so much for joining us. Best of luck with everything as you guys continue to help the health system, traditional health system, take care of all these folks out there who are sick. We'll talk to you soon, hopefully in better circumstances than this. Thanks so much, Jenny. I'm Jessica.
Sounds great. Stay safe.
I'm Jessica DeMassa with WTF Health. Thanks so much for joining us.